I'm Dr. Saadia Virk, CEO and Chairperson of Board of Directors, working at present at South City Hospital, Karachi, Pakistan. Let me introduce myself. I graduated in 1986 from Fatma Jinnah Medical College, Lahore, and then I came to do a residency at Al Khan University Hospital, Karachi from 1986 till 1989. Towards the end of 1989, and did my residency in gynae and obstetrics, and then I decided to go to UK for further higher education and training. I was very fortunate to have gotten my first job at the Imperial Science College, which really reshaped my career in and around London, basically working at St. Mary's Hospital, London, where I worked in high-risk obstetrics, gynae oncology, that's cancer surgery, and then moved on to Basingstoke District Hospital, where I worked in infertility, again in high-risk obstetrics, gynae oncology, as well as training for IVF. I moved around doing various jobs in UK, learning various further experiences, and then decided to come back to Pakistan. When I came back to Pakistan, I got affiliated again with the Al Khan University, but then I developed private units all over Karachi, at OMI Hospital initially, then at Mid East Hospital, and then I decided to set up hospital for consultants where like-minded people could work and provide a care which would be safe, cost-effective, and evidence-based care. So I gathered a group of doctors in 2005, and we bought an old hospital which was a 10-bedded facility and renovated it, and now mashallah it's a 175-bedded general hospital which provides all subspecialties. So going through this journey, it was a great learning experience for me. I then decided, because there was a transition from open surgery to minimal invasive and laparoscopic surgery, so pursuing with my own professional development and developing a healthcare institution, it was really demanding, but I did my conversion to a laparoscopic surgeon way back in 2006 to 2007, and I had to go to France for that. I had to go to USA, and I really had to work hard and did my transition, and alhamdulillah, Allah has blessed me with the skill which I have used in Pakistan in treating my patients, especially with pelvic endometriosis and gynae cancers. So most of my work now is laparoscopically done, and I have established an IVF center at the South City Hospital. I have developed state-of-the-art maternity unit with a very well-equipped NICU which takes care of maternal and child health care. My colleagues supported me through every step, and we have developed a general hospital which takes care of general surgery, bariatric surgery, hernia surgery, cardiothoracic surgery, breast cancer surgery, orthopedic surgery, interventional cardiology, and our subspecialty, which what we are now known for is critical care services, interventional radiology, and our excellence in emergency care in our emergency department. I have gone through various challenges, especially during COVID, which taught us a lot about the new upcoming healthcare with negative pressure installation, air conditioning system, etc., etc. COVID really was a great learning experience which ended up in contributing a lot towards research, development of healthcare, and I was also very fortunate that I was appointed a health minister as well as an education minister and a population planning minister way back in 2018, which really gave me an insight to healthcare at a mega level. So healthcare planning and development has been a passion since then. How can we make it better? How can we excel? And how can we address the main challenges in healthcare now are not the machines, it's not the money, it's the healthcare development, healthcare personnel, because there's a paucity of healthcare personnel, especially the nurses, the paramedics, nurse aides, that group, because all over the world there's no shortage of good doctors. Doctors are being produced according to the population. It's the allied healthcare support. So I have dedicated myself now with a vision to develop and become self-sufficient for our own country, as well as go on a global level where we produce trained healthcare personnel and focus on training, teaching and training along with patient care, and perhaps provide opportunities to our graduates, to our nurses, nurse aides, technicians, pharmacists, physiotherapists to go abroad and seek job opportunities. That will bring legalized way of bringing revenue, foreign currency back to the country. Secondly, it would be all legalized way of immigration and getting job opportunities. Third, it will provide a lot of opportunity to our women to come and invest in this specialty so that they can be self-sufficient and self-empowered. Apart from that, we need to develop more strategies and methodologies for being more cost effective, because it's all about healthcare which is cost effective. It should be value for money healthcare. It should not be a very, very expensive healthcare which is not sustainable in the long run. We are a poor country, we belong to a third world country, so each and every step that we take or each and every move has to be cost effective, sustainable. We need to create sustainable, self-sustainable models. I am really proud to say that we started with a 10-bedded facility without any donations, without any charitable budget. We have expanded to 175 well-equipped hospital. We have expanded on our own means, and the best part has been that we have never neglected our underprivileged population. I would give a small example that our general wards are subsidized by 20%, whereas our VIP rooms are profitable around 30 to 35%. So whatever we earn through our VIP rooms, they subsidize the care for our poor patients. For further expansion, maintaining our budgets, paying our salaries, paying our bills, it is the private room and the semi-private which gives us sustainability, but our VIP rooms generally subsidize our general ward care. So it is a model that is replicable, which can be sustainable. All we need to focus is developing human resource along with clinical care, because that's the way forward. You cannot sustain any healthcare institution unless you have a limb for teaching and training the healthcare personnel. Apart from that, the take-home message that I would say is that there are three aspects to patient care. The first is the patient. So everything has to revolve around the patient's welfare in the short term, immediate, long term, whatever is sustainable or good for the patient. That's our priority number one. Second is the care provider. we have to look after the interests of the care provider. We need to look after them, their families, their problems. Like a lady with small children, we have to really factor in her constraints, having smaller kids, or having an elderly parent at home. How do you factor in her problems so that she stays focused to the job? So we need to look after our staff, healthcare providers, providing them a simple, decent meal on job. That would make a difference. Looking after their transportation, clean uniform, that would make a difference. Above all, giving them respect, treating them like colleagues. Anybody who's a watchman or a porter or a cleaner is as important in the hospital as the CEO. So the level of respect has to be the same for everybody. Lastly, the third party which is involved is relative. In our culture, it's not the patient. It's the whole family which is unwell. So we really have to factor in and look after the relatives. Due to our cultural norms, the family has to come. For example, in an intensive care unit, if your patient is on a ventilator, the patient is comfortable, cannot feel anything. But the relatives are there 24/7, standing in the corridors, whether they've had a decent cup of tea, whether they have had an access to a clean toilet, or they've got a decent place to sit, where somebody cares about the relative, because relatives are your ambassadors who would say whether you're good or bad. So we really have to create an atmosphere where we are giving a wholesome care. It's the experience that the patient has. It's not just one-time event. You have to give them a sense of belonging to the place. We don't mean that we keep inviting them, or we do wish them well, but whatever we do, it has a long-lasting impact. So we need to be more realistic. With a vision, we need to contribute towards research and development, because the research is the main aspect which gives you an opportunity to improve yourself, to develop newer things. So we really need to be focused on, other than medical education and human research development, we need to be focused on research, and our audits have to be absolutely transparent. The last key to healthcare is the costing. If your cost is right, you are successful. If your cost is not right and you are continuously dependent on funds from somewhere else, I don't think that is a good model or sustainable model. The robust healthcare would be with costing, with patience, with knowledge, with analysis. Thank you.